This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Responding to any disaster can be tough, whether it's man-made or a natural one.
Natural disasters, example of that are floodings, earthquakes, typhoons, tornadoes, and man-made bomb explosions, fires, chemical spills.
The situation may call for an immediate response to a car crash, medical emergencies, drowning, or other physical threats.
When you talk about emergency preparedness, the term itself means the steps you take to ensure safety before, during, and after an emergency or a disaster for that matter.
The needed response usually depends on the severity of the situation.
We cannot underestimate the importance of coming up with being prepared. And you talk about being prepared, you talk about having a plan for every emergencies or disaster.
The manner by which you should respond to an emergency is also vital in aiding someone in danger. Being conscious of the time frame to respond, for instance, should be a priority. The immediate response and preparedness may spell the difference in someone recovering quickly or yielding to permanent disability.
In scene sides up, we have to ensure the safety of the responder. So that's yourself. Second is your partner. Third is your patient. And then fourth is the bystanders that is present in the area.
Whether you're at home, school, or workplace, you should always have a solid game plan if ever you find yourself or other people in danger. What should you always have in your first aid kit? What are the steps in performing CPR? How can you properly administer the Heimlich maneuver? Find out the answers tonight on MedTalk. And joining us tonight is Mark Libo-on, the Academics and Operations Director and a Senior Instructor from Stout Risk Reduction Management Training and Consultancy Services. Also with us tonight is Pamela Cruz-Briones, a licensed physical therapist and a senior instructor also from Stout Risk Reduction Management Training and Consultancy Services. You may join our discussion by calling our hotline at 548-4678. Good evening, Pam. Good evening, Mark. Welcome to the show.
Good evening.
Emergency preparedness. In the VTR, it was already explained, but can we take it from a different angle this time? What do you mean by emergency preparedness? Mark.
Emergency preparedness answers the question of how ready are we emotionally, physically. It also means the government's effort in pre-positioning equipment, assets before any disaster would strike.
Mm-hmm. So in being emotionally and physically ready, are we ever emotionally and physically ready for an emergency? Pam?
Actually, it's not always that we can prepare for such, but if you have certain training or knowledge on certain events or disaster, or you have a basic knowledge at least of first aid, so if that happens, it will really pop out from your mind. Mm-hmm. So what to do?
Parang stock knowledge.
Yes.
No? So when you're faced with this an emergency situation,
yeah,
yung stock knowledge mo from training and hopefully from watching this show today, because we're going to teach them the basics of first aid. We're going to teach them all they need to know when faced with an emergency situation.
Yes.
So, and speaking of an emergency situation, what are the most common emergency situations, man-made or natural, that we Filipinos face?
Yeah,
Mark?
for man-made. We do have fires, chemical spills also, with stampede, and of course for natural disasters, we are very frequently visited here by storms, typhoon, earthquake, floodings, those stuff.
Those are quite common.
Those are the common ones. And recently there was an earthquake, and we suffered other natural calamities. No, with the behavior of Filipinos or people in general, what are some of the common mistakes that we commit when we're faced with an emergency situation? Let's say a flood. Like you've mentioned earlier, we're never prepared physically and emotionally. So what should we be aware of? How alert should we be when there is a flood? Mark?
Well, actually, what the problem is, people would panic. Panic would usually be because they don't know what to do. So for people that to be overwhelmed with those events, they should be ready before any of those events would arrive. Listening to shows like this would make them prepared. Attending seminars, workshops, and of course training would make them better prepared. Like athlete, before a big event, you should practice also. So drills are very good prior to any disaster.
And they have that in schools.
Yes.
They're the fire
Schools,
drill,
company,
the earthquake drill. Yes.
it's a prerequisite for them to perform such drills, which is also assisted by our LGUs at the same time. But in our group as well, we also, that is a part of our advocacy to provide such assistance for those who ask for such trainings or drills maybe. So at least we can impart a few of what we know.
Right.
So, yeah.
Yeah, and so we've talked about the floods, na common mistakes. What are some emergency common mistakes, no, na we face or that we are that we'll deal with na hindi talaga tayo handa. Aside from floods, earthquakes, what else do we face that we're not really prepared for?
Fire. Most people would usually think that going to the bathrooms or comfort rooms in case of fire would save them, but actually it's not.
Okay.
Because of course there are pipes, water pipes that would also be very, very hot. So if they open the faucet, very hot steam would come out and would kill them. So basically what they need to do is plan before a fire. So a simple talk like over a dinner, talking about what to do in case of fire, where do you go to, who do you need to call, what things do you need to carry, because you don't need to bring your refrigerator or anything outside, just the very important things.
Yes, you're a family member. And in addition to that,
Yes.
If you are employed, for example, you should know where is your fire exit. So you should know what is the drill protocol for such emergencies, who is the person to supervise. So at least you will be aware of what to do, where to go, and who to call. So, that is
So
to
where
support.
to go, who to call, and what to do, no? Try to be as alert as possible and try to be focused, no, with the people around you and your environment. These are controlled situations, like in a fire or sometimes even flooding. But when you're outside, like landslides, it happens and you have no control. So how prepared can you be in a scenario like this?
Well, making sure on what you need to do just in case. The only thing that you really could do is not panic.
That's the first thing.
Yes, that's the first thing. I
Okay.
mean, there's no recipe for like what do you need to do if you're caught in a mudslide.
Yeah.
You could not survive, like
No.
things like that. But remain calm and focus, because if you're in a panic mode, your mind's not going anywhere else.
Correct. And if you're in panic, instead of saving yourself, you may harm yourself even more. You've mentioned the common behaviors that people in general make when faced with a situation like that. You mentioned flood earlier, and what should we do when there's a situation like that?
Well, The very, very common misconception is usually they always think that there will be people coming in to save them, so they wait until the water goes very high and expect people, rescuers, to come to them. Well, for your information, we don't do that. We make sure first. Preparedness is what we always usually tell them. Before the water gets high or the water rises, if that's inevitable, get out. Save all your very precious belongings, papers and things like that. Leave all the other things that you cannot carry. Listen to the warning device. The warnings issued by Pagasa or LGUs, which have very good equipment. Because rescue would only come for those who really need it.
Okay. So in effect, you also have to save yourself before others can save you, no?
Yeah, well, we believe that you could save more lives if you yourself is safe.
Before we cut to the break, we've talked about floods. How about during a fire or an earthquake? What should we do?
For fire, well, for small fire, you could try to extinguish it yourself. Just make sure that you know what to do. Well, for small fires, you could douse it with water. For bigger ones, don't be a hero or don't be a firefighter.
Okay.
Call an emergency hotline. Make sure you know where to call. The nearest emergency or a fire department could help. Get out, get everybody out, and stay out.
That's for the fire. For earthquake, briefly, Pam.
For earthquake, basically, most especially our loved ones, the very old and very young. So we really need to orient them at least on what to do and the emergency number to call and specific routes and where to go, because most of them have certain difficulties in saving themselves. So at least we can endorse them to somebody else if that happens. So at least they can look over them, and also know the first aid if they encountered one.
So you mentioned first aid. We will talk more about emergency preparedness. We'll talk about first aid. We have a demo coming up. All that and more when MedTalk returns.
Did you know that while a human being can survive for roughly 3 weeks without food, the longest time that an individual can go without water would be around 3 days up to only a week?
We're back here on MedTalk, still talking about emergency preparedness. You may join the discussion by calling our hotline at 548-4678. Before we cut to the break, Pam, you mentioned the first aid kit. So now let's go to the first aid kit. What is the importance of a first aid kit?
Actually, the importance of our first aid kit is basically we mentioned basics. So when we deal with basics, you should have one to address the wounds, okay, like your betadines, your micro-4, your gauze, different kinds, or at least a roller gauze would do. And then you have a thing for dislocation or a fracture, at least an improvised splint or triangular bandage. Or if you don't have, you can just improvise with a specific shape like such to address the dislocation or fracture to support. And then basic medicines, let's say.
What are the basic medicines?
Over-the-counter only, dealing with fever, if you have had, like paracetamol, pain reliever. Those are just for 24 to 72 hours, actually. So until help comes. But as much as possible, we do not self-medicate. So we do not support that. But if in worst scenario, if you really need such, so at least you have with you handy. Pain relievers also do, like liniments, what you mentioned, like tiger balms and such, the external ointments for muscle aches and pains to alleviate fever. Our compresses, a cold compress, we can have those also in our kit.
This is a first aid kit that you must have in your home or
Yes,
in the
anywhere.
office. Any office should also
Yes.
have their own first aid kit, isn't that right? Yes, Mark.
Yeah, it's really important to have those things because in an emergency, it's very, very difficult to look for a gauze pad, an adhesive, or something to clean your wound. But if you already have it, it's very easy.
Okay. So in your car and in your home, what about your personal first aid kit? Like what every woman or man even, because men carry a purse as well. So what should you have in your purse? Which are the basics, the most important?
It's quite funny actually, but we usually teach it to others. Even men do.
Okay.
The sanitary napkins or the panty liners.
We have it here.
Yeah, we have it there. We have different liners there. So if one encountered wound, so you can use that it's clean, it's absorbent, and it's very handy.
Mark is
and
smiling.
It's cheap. It's cheap, right?
Yes,
How much?
yes.
I think five or 4 pesos.
So we should always have that in our bag. What else
for
should we have?
bleeding and such. So,
Adhesives.
yes.
Yeah. If it's okay to mention it, it's Band-Aid or any adhesive strips. It comes in very handy. If you have some little wound or little scratches, you can use those. Very, very commonly, you could just carry in your pocket.
Okay.
That's it.
So those are the very basics, which I think we all have in our bag at some point,
Yeah.
right? And if the men do not have these, the women for sure will have it.
Yes.
You're wearing gloves, Mark. Is that part of?
Well, from the practice of the emergency medical services, emergency medical technician would make sure that they are clean, they are safe, they have body substance isolation so that any fluid, because any fluid coming from you or from the patient would pose a threat of infection. So you might as well make sure that you're okay.
Okay, so in making sure that you're okay, you can show us the anatomy of your first aid kit or the kit that you have here.
All right.
Please, Mark.
So basically what we do have are adhesives. So we do have different types of adhesive. This one is self-adhering, so you could use this and not use any other adhesives, and it would adhere to itself. We do have also bandages, thick ones. We also do have absorbent gauze pads.
As
So it
mentioned.
comes in many sizes, so different types of wounds, different sizes available. We also do have carry with us, even though we do have our triangular bandages. Comes in
Okay.
very handy.
Okay, when do we use the triangular?
Well, it has a lot of use, actually. You could use it to keep the dressings in place. You could also use this for a sling to immobilize any fractured arm or any parts of the body,
Okay.
basically. Roller gauze. Yes, we also do have this to stop very severe bleeding.
Okay, what's the difference between that gauze and the gauze that you...
Well, this comes. Well, this one has would have a clotting effect on big wound.
Okay.
So if the wound is not stopped by these very small absorbent ones, these are more effective. Right, we also do have with us on our kit an automated external defibrillator, as in case you would encounter people who have cardiac arrest, no pulse and no breathing. Aside from doing CPR, you could also use the automated external defibrillator.
Okay. Well, using all of these things is what, when we call for help,
Yes.
when someone needs help, these are the things that you will take with you.
Yes.
Okay. So Pam, maybe you can talk to us about this one, this portion
Yes.
over here.
This one that we have here is also a part of our 72-hour kit.
72-hour kit.
Yes, because sometimes when we talk about just first aid kit, it's just for temporary, for a short period of time. But if we're talking about maybe calamities or disaster that happen, it should contain your first aid kit plus supplies that will help you survive within 72 hours.
Okay.
Because it's not always that aid come immediately for us. So at least we have certain bottled water here. In our kit, we have food. We need to remember that it's not always that we can cook. So, but if we can have handy matches or lighters along, that will also help. But flashlights, batteries, extra chargers, and energy drink or coffee will do. Biscuits, and here we also mentioned our sanitary napkin, which is multi-purpose.
Yes.
Yes. And then our, if we do not have an ear thermometer, we can have a digital thermometer will do. And also, as much as possible, we have our 3P app, blood pressure, to check blood pressure. And we also have things to provide for our bleeding, such our microphore, those that Sir Mark also mentioned. So, scissors and stuff.
So with all these things needed in your first aid kit, this is a very professional first aid kit. What is the importance of being able to apply it right away? And how many minutes or minutes lang? I just want to talk about minutes, not hours even, that you must administer first aid.
Yeah, for bleeding, especially, there are different types of bleeding. We do have different blood vessels in the body that would behave differently. So if a blood vessel is cut, especially if it's an artery, it would bleed profusely, it would spurt, and in a matter of a minute or two, you would lose a lot of blood. And if that happens, patient would usually go into shock, and we don't want that to happen, because if you go into shock and if it's not treated immediately, you could die from it. So severe blood loss usually is one of the most common cause of death for patients who don't know, or for patients who suffered from an injury and nobody knows or doesn't have a first aid kit to stop the bleeding. Well, some of them are afraid to touch the blood. So
yes, not everyone is as brave as you guys or other people who are not afraid to touch the blood, or the sight of blood doesn't scare them. So this is for intense bleeding or profuse bleeding. We'll talk about for someone who has suffered a stroke. We'll talk about that. We'll talk about fractures, and we'll talk about other important first aid tips.
Yes,
we have a demonstration coming up, and injuries. You're right, Pam. All that and more when MedTalk returns. We're back here on MedTalk, still talking about emergency preparedness. You may join the discussion by calling our hotline at 548-4678. Okay, as mentioned before the break, we now have a demo, a demonstration on how to apply CPR. Perform CPR. Mouth to mouth is CPR, right?
Well, part of CPR, but we don't actually encourage it to civilians anymore.
No, not anymore. Okay,
not
why is
anymore.
that?
Well, for the new guidelines, we do follow a guideline on how to perform CPR. there are a lot of problems when it comes to contamination and risk of infection,
Okay.
especially if you do mouth-to-mouth.
All right.
You cannot choose who would be the victim, and you would not know
Yes.
if they have diseases or things like that.
Okay. So since we're talking about not doing mouth to mouth, how is CPR performed? Let's say our patient is drowning.
Okay.
How do we perform CPR?
Well, of course, you have to make sure first that everything is safe. We don't perform CPR in the water, so you have to bring the patient in the land and make sure that the ground is firm. So for this patient, if the patient is not moving, we have to make sure first that we check if the patient is responding or not. Right? So tapping the shoulder would usually check if the person is alert. If not, you could pinch the ear
Okay.
or the earlobe. You could also do it here just to elicit pain, because people sometimes, if they are unconscious, they would respond to different stimuli. So for this one, if the patient is not responding when you elicit pain, more probably this patient does not breathe or doesn't have a heartbeat.
Okay.
So if that is the case, if the patient is unresponsive, make sure that you always call for help. You always call for help. Otherwise, if you don't know what to do, this person would die.
Okay.
So call for help, and once the patient is already established is not responding, what we usually tell people is we locate the center of the breastbone. So the center of the breastbone is somewhere in this part here. What you need to do is place the heel of the palm, lock. Make sure that this is facing forward so that it would be locked, and start compressing, making sure that you allow a rebound of the chest.
Okay.
So for civilian, we usually encourage them to compress at least 100 compression per minute. They need to do this for like 2 minutes. So 2 minutes.
And the purpose of which is to...
The purpose actually of CPR is to buy time for the patient, because actually you could not bring back the heart from not beating hard to something that's beating again. What you usually do here is to give the brain its needed oxygen, because in the blood there are still oxygen left. So what you need to do is you need to recirculate those so that the brain would get the much needed oxygen. Brain would start to die in 4 to 6 minutes. So if you don't do anything, this patient may die in like 10 minutes.
So while you're performing the CPR, someone is calling for help to...
Someone is calling for help.
Okay.
So you need to continue compressing. Before, we usually tell them to give full blows or blow to the mouth. So this is what they usually do before.
Okay.
But since problem with contamination, infection, and things like that, we could do hands-only CPR.
Okay.
So at least 100 per minute, and you
Compression.
do this in 2 minutes.
Okay. And what do you hope to see, or is anything very visible when you do that? For you to know, or is there a sign that the patient
stop, when
is
to stop.
okay, or when to stop? Yeah.
Well, the only time that you would need to stop compression is when you see that the patient is already moving or is responding.
Okay.
If it's not responding, you still continue to do CPR.
All right. Okay.
One other thing that we also would like to encourage the general public to have is this, and of course our government to have, is this. This is your
What is this?
automated external defibrillator. This is designed so that anybody could operate it. Even a monkey could operate this, as long as he knows those
To follow
buttons.
instructions.
Okay. What is
Okay?
its function?
So this actually would make the heart beat again normally.
Okay.
So it delivers an electric shock to the heart. So if you have this available, this would save a lot of lives.
Do you encourage every home to have one?
Well, this is a bit expensive.
Okay.
But for like a barangay to have one is,
a
well,
huge-
this is what we encourage them to have. In an office, it's very ideal.
Yeah.
Buildings with so many occupants, you should also have this one, because who knows.
Okay.
This is how it's used, actually. So it has numbers, tell you which one you need to push first. So to turn it on, all you need to do is press this.
Okay.
So you need to press the on button, and then of course
Apply pads to patient's bare chest.
it has a voice prompt. So all you
Plug
need
in
to do
pads connector
to follow.
next to flashing light.
So it has also a direction here. So if you see that one, make sure that you expose the chest,
Okay.
patient's chest.
Apply pads. Plug in connector.
So this is for, well, encourage for the barangay to have, the offices to have as much as
Yes.
possible. Pero hindi lahat meron
Can
yan or
afford.
can afford
Can
to
afford
have that. So,
Apply pads.
okay.
Plug in
But
connector.
sige, let's
So
take a
this
look
is
at
what
this one.
what you need to follow. It's very, very easy. It has a drawing that you need to
Okay.
follow. So,
So-
just place the pads.
What emergency situations can we
Apply
use
pads.
this?
Insert
with?
connector.
Any
firmly.
patient who's not breathing and this doesn't have any pulse,
Okay.
not responsive at all, you could use this. Okay? This is the only way that you could bring the heart back. So once it's plugged in, all you need to do is just listen for the.
Analyzing heart rhythm.
Okay.
What it does is analyze
Do
if.
not touch the patient.
Okay.
So when it says do not touch the
Do
patient,
not touch
do
the
not.
patient. Okay, hands
Yeah.
off.
Nobody touches the patient
Shock
because
advised.
Okay, so
Charging.
so it
So
will
it
deliver
will-
a shock.
Stay clear of patient.
Okay, so you're clear, everybody clear.
Deliver shock now. Press the orange button now. Shock delivered.
okay.
So
It's a detailed instruction of how to
Begin
bring the heart
CPR.
back to
And then
life.
it will tell you to go back to CPR again.
Okay.
to continue again.
All right.
So it's that easy. It's just like ABC, but
Yeah, ABC for those nga who can.
who can afford. But
Yes, but to those who are not able to get a
To
hold
buy
of the
one.
machine or to buy one, the first
the
few
knowledge of the
CPR measures
procedure.
were done by
Yes.
Mark, and that's what's good. No, that's
Yes.
what will also bring the heart back to life and
Yes.
save the patient. Now we move on to bleeding. How do we treat a patient who is bleeding profusely?
Okay. We usually follow a mnemonic so that civilians would be easy for them to remember. So just remember the letters D, E, P, and then T.
D, E, P,
P and then the
and then
T.
T. This is for bleeding. No?
D
Depth.
stands for direct pressure. So if you see
For example, na lang.
bleeding,
for you.
so
Okay.
For
yeah.
example,
So for
here.
that one,
Okay.
so the wound is
Correct.
bleeding automatically. That's actually a reactionary. That's a reaction. So you just need to
Press.
apply a direct pressure. That's
Okay.
letter D. And then, of course, if it still bleeds, so you need to do a follow letter E, which is elevate. So you need to
Above the
elevate
heart.
above the heart.
Okay.
So above the heart. And then, of course, letter P is look for a
Pulse.
pressure point.
Pressure point.
So the pressure point for this one, for that type of wound, is in the brachial
Here.
pulse. So
This is your elbow.
Okay.
go down and press because, of course, this supplies blood here. So if
Yeah,
you
it's
apply
going up nga when you
pressure-
pressed it.
Yeah, so if you apply pressure, it
Yeah,
minimizes the
apply.
bleeding.
You will feel tingling sensation here, meaning
Okay.
I'm applying too much pressure.
Oh, okay.
There's decreased
So,
circulation already.
so it's just like minimal pressure lang, so
Yeah,
that
just to minimize the bleeding.
okay.
And of course, if worse comes to worse and you could not stop the bleeding, letter T is transport.
Okay.
Yeah.
Bring the patient
Four
to the
pads
hospital.
contact.
Okay.
Re-
Still talking to us, but we've moved on to bleeding.
Yeah.
So that's how we administer first aid for someone who was bleeding profusely.
Yeah.
And you said the pads are equally
Yeah,
important.
the sanitary pads, or if they have those
Gauze pads.
gauze pads that
Okay.
Sir Mark mentioned about having its clotting factor there.
Okay.
So that would ease. And
That would help.
ano,
How about for
help a
heat
lot.
exhaustion?
Yeah, for heat exhaustion, it's usually just the body going into like a very, very high temperature. So you need to cool it down because, of course, once the body is subjected to a very high temperature, it would have a detrimental effect on the brain. The brain loses its connections also. It misfires. So if it's too hot, sometimes the mental status would change and sometimes it would cause seizures. And we don't want that to happen. So before that would happen, you have to make sure that bring the patient to a very cool place.
Hydrate.
Inside probably an air-conditioned room.
Yes.
Or
Or
anywhere
a fan.
The tendency kasi of people is to crowd,
Yes.
you know, to go
We need to
near
clear.
and to investigate what's going on. But that person needs to breathe, and that person needs air, as you mentioned.
Yes.
Bring him to a cooler place.
He needs to cool down.
Okay.
So, of course, once you bring the patient to, or the person to a room, douse it with water or get a something to rub the patient off.
Okay.
An electric fan would help also. Just make sure that the temperature goes down. If it's not succeeding, bring it again to the hospital.
Okay.
Yeah.
So, basta you try to do your best with the first 8 tips that you've been giving us, and then
Yes.
if that doesn't work,
We can use
Or even if
ice
it works,
also,
no? You
if
can-
you have ice or any cold stuff.
Yes,
we can use.
if the patient would usually, I mean, if the temperature goes down, the patient would usually would recover.
okay, and no need to bring the patient to the doctor once the patient has recovered
Yes.
because of the administered first aid.
Yes. You can also advise the patient to inhale and exhale properly, like inhaling through the nose and exhale through the mouth, the proper breathing pattern. Because sometimes if you experience something wrong in your body, you tend to panic. So you tend to hyperventilate or such thing. Of course, it will aid if you talk to the person, look me straight into the eye, follow me,
Okay.
inhale, and then exhale through your mouth. It's like doing yoga, right? So
Yes.
it's like that. But
You
it's just
mentioned
relaxation method.
relaxation method, not to panic, but you know, sometimes it's really difficult not to panic. So
Yes.
when we come back, we'll talk about having a solid game plan, about trying our best not to panic and to be of help to others instead of add to the pain that they're experiencing. When MedTalk returns, we'll talk more about emergency preparedness with Pam and Mark. We're back here on MedTalk, still talking about emergency preparedness. Mark and Pam, this is the last segment of the show. We have to remind them again the importance of having a solid game plan in case of an emergency. So, what should we remember? First and foremost, what should we remember?
For in any emergency, always remember, stay focused and don't panic. Next is, in order for you to do that, study, learn, and read about things that you don't know, especially in case of emergency. For you to easily remember all things to do in case you encounter those emergencies, we have some mnemonics for you so that you could easily remember it. For wounds, we already mentioned DEPT, so
Okay.
D-E-P and T.
Okay, please remind us again what
So
DPT means.
D stands for direct pressure. E is for elevation. P is for pressure point, and T is, of course, transport.
Okay.
Now, for cases like dislocation, sprain, strain, and of course fractures, so musculoskeletal injuries, just remember the word rises. So we eat rice, so more rice, rises. So
Okay.
R is rest, E is elevate, C is compress. Remember, if it's the first time, the earliest is cold compress, and then hot compress after that.
Within the 24 hours.
So cold compress, 24 hours.
Within the 24 hours.
After the injury, and then warm compress, 24 hours.
After 24 hours. Because the concept of which is if within the injury itself, it's acute, within the 24 hours, our blood tends to pool on that specific area that is damaged. So if that happens, we try to, by using cold, it tends to delay.
Constrict the blood vessels, so it prevents
swelling. So further swelling. So it will control and minimize swelling as well. But after, then we will use hot compress then.
Okay. So those are for wounds, fractures, and sprains. How about if someone is suffering a stroke?
Stroke, yeah. Very important is to recognize first if it's really a stroke. And nobody could actually tell if it's a stroke. You really need to go to a doctor. So there are 4 words for you to remember. So the mnemonic is FAST. So F is for facial droop. So if you would notice, the face would usually be asymmetric. So one is drooping, the other one is okay. So ask them to smile. If the smile is asymmetrical, the other one is not moving, then you could suspect that it's probably a stroke.
Yes.
A is, of course, let the person raise those 2 arms. So arm drift is letter A. For a patient who suffers stroke, one of the arm would usually go down.
Okay.
It loses control. S is for speech. Let them talk. If they could talk straight, it's probably not a stroke. If the speech is slurred, then suspect it's really a stroke.
Okay.
And T is, of course, time. Ask them how long did that happen. If it's like more than an hour, bring the patient to the hospital because they need to rule out if it's really a stroke. If you suspect those 3 to be present, facial droop, arm drift, and slurred speech, bring it to the hospital because sometimes after 24 hours, patient would usually go back to normal. They call it as a transient ischemic attack. So it goes back, but then again, it's a prelude to a bigger one, so it would be recognized as a stroke after 24 hours, after diagnosis, checking if there are, they do CT scan, if there are blood vessels that have ruptured or if there are clots. So earlier recognition is very important for stroke.
Okay. Mark and Pam, we have a Facebook question. If a pregnant woman chokes, should I do the Heimlich maneuver, or can it harm the baby? First, what is the Heimlich maneuver?
A Heimlich maneuver is actually it developed so that it would get rid of a dislodged object in the mouth, in the airway.
Okay.
So what you usually do, if you notice in the video, the patient uses the fist. So you have to locate. It's just between the belly button and the sternum. So you need to go at the back of the patient. Ask them first if they could talk, they could cough, or they could breathe. Because if they could talk, they're not choked.
Okay.
If they could cough, they're not choked.
Okay.
You can clear airway.
So what you basically would need to do is place, as you see in the video, it needs to place it just above the navel, just between the rib here.
Yes.
And of course the navel, just place and then push it inward, upward motion.
But in the video, the lady is not pregnant. So addressing our Facebook question.
Yeah, for pregnant women, since of course the tummy or the belly is very big.
Yes.
It's also applicable for very obese patients. So if you could not reach, what you need to do is just go on this side. So it's the same side where you do your compression for CPR.
Yes.
So all you need to do is just place a closed fist and then pull it towards you 5 times. 1, 2, 3, 4, 5, and then stop every time and then look if the object has been dislodged. And again, continue until it dislodges.
So this applies.
That's for pregnant women.
Okay.
And obese.
Pregnant and obese.
And obese.
And for the elderly, how
For the elderly,
do we
it's,
help
it's
them
the
when they
same. It's
choke?
the Heimlich maneuver.
Yes.
still the Heimlich?
For,
And for children?
For kids, there's
Okay.
a difference if it's an infant.
For infant, if it's a baby, if it's like a baby like this,
Okay.
For example,
what
this is
you
our
need to do
baby.
is just hold the baby facing the floor with your hands on its mouth. Okay, place it and then just on the shoulder blade,
Here.
give blows slowly. Give blows because of course the bones are still very delicate. So
Just tap.
until it dislodges.
Okay.
You don't need to shake the baby or do anything.
Okay.
Or
Yeah.
All right.
the
So just
mouth
turn the
or
baby
anything
over
else.
and 5 times again at the
5
back.
times
How
and-
about for pets?
For pets,
Yes.
well, you should be very
beloved
familiar with
pets,
its
yes.
anatomy.
Okay.
They would have really different anatomy like us. We do have flat chest. Unlike dogs, they have, I mean, the heart, I don't know where the heart is. So as long as
Yeah.
you know where the heart is,
Yes,
that's where
yes.
you need to pump.
Okay, all right. So we discussed for infants, for children, for the elderly, pregnant woman, for obese, and
For the unconscious one,
for the unconscious one. Yes, you mentioned that we have to communicate, we have to ask. But if the patient is unconscious, how do we ask or probe into how
well,
the
you need to
patient feels?
As for bystanders, what happened? If they told you that the patient was doing this before he collapses,
Yes.
let's suspect it's a choking incident. Because this is, of course, a universal sign for a choking patient.
Okay,
So
all right.
if they confirm that that happened before he collapsed, all you need to do is just go on your knees, doing the same thing as the CPR, because probably by the time the patient collapses, he's no longer breathing and no longer has a pulse. So start CPR immediately
Okay.
for unconscious patient.
So that is the universal sign for an unconscious patient.
For choking.
For
choking
choking.
patient.
So what are the other signs that can help a patient when faced in an emergency situation? Or like a bystander or like a loved one or a family member, any signs that we should learn or know?
Yeah, well, for choking patient, this is universal.
Okay.
For other medical emergencies, ask them if they're not feeling well,
Oh, that's it na, no?
and remember ABC. The ABC of life is A is for airway. Make sure that the airway is patent. It's open. They could talk, they could breathe, they could cough. Next is letter B. Check for breathing. If the breathing is normal, adult you usually have 12 breaths per minute.
Per minute. Okay.
So you just need to look at them and, well, don't tell them that you are counting their breathing. They might get conscious.
They will
And then,
control.
okay, and then letter C is your circulation. Check the finger, press it for a capillary refill, right? Or either you check here or the palm, because normally the skin color would be pink.
Okay.
It should not be bluish or should
Pale.
not be pale. It should be pink.
Okay.
Otherwise, they're not normal.
All right. And if they're not normal, you're already in a panic, you've maybe some of the information passed on has slipped your mind, but you must know a phone number to call.
Yes.
So what number or numbers should we have on our speed dial? Or
Well, in the Philippines, we do have 117,
okay.
but a bit of advice. In the Philippines, we do have a bit of a problem with what we call a universal emergency number. We don't have a single number that we could call who could effectively respond to emergencies.
Okay.
We do have 117, but it does have limitations. So my advice is if you live in a place, know the local emergency number.
Or stout.
Yes.
Or stout.
It will help as much as
Yes,
you can.
a number to call or a site
It's
to visit?
02-296-6789. It's quite easy. Or 0917-871-2595. Our website is stoutcon.webs.com.
For emergency purposes and for learning purposes
Yes,
as well.
if they want certain trainings as well, or they just have certain questions, can assist.
Okay, and to know more about how to be prepared, better prepared during
Yes, to be
emergencies. So, Pam, any final words, Mark, briefly, to our viewers?
Yeah, very importantly, when faced with emergencies, just don't panic. Panic could kill. So make sure that you study your lessons very well. Don't be a hero. Read and read everything about emergency so that you would be prepared.
Okay, thank you very much, Mark. Pam?
Know what you need to do, and especially to take care and check your safety first, your body or your family member, before your valuables and stuff. And then at least inform your friends, have an emergency number to call, what happened with you. So at least somebody will, in case you have lost connection, somebody already know that you're in danger or you're in need of help.
Okay.
So yeah, continue Googling out or training
Yes. And
or calling your hotline.
calling the hotline
Yes.
and just researching more on first
Yes.
aid. Right? So thank you very much, Mark and Pam, for educating
It's
all
our
of us
pleasure.
on how to be prepared for emergencies.
Yes.
We'll see you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Take care, everyone. Good night. What are some of the common mistakes that we commit when we're faced with an emergency situation, let's say a flood? Like you've mentioned earlier, we're never prepared physically and emotionally. So what should we be aware of? How alert should we be when there is a flood? Mark?
Well, actually, what the problem is, people would panic. Panic would usually be because they don't know what to do. So for people that to be overwhelmed with those events, they should be ready before any of those events would arrive. Listening to shows like this would make them prepared. Attending seminars, workshops, and of course training would make them better prepared. Like athlete before a big event, you should practice also. So drills are very good prior to any disaster.
And they have that in schools.
Yes.
They're the fire
Schools,
drill, the
company,
earthquake drill, yes.
it's a prerequisite for them to perform such drills, which is also assisted by our LGUs at the same time. But in our group as well, we also, that is a part of our advocacy to provide such assistance for those who ask for such trainings or drills maybe. So at least we can...
Drowning or other physical threats.
When you talk about emergency preparedness, the term itself means the steps you take to ensure safety before, during, and after an emergency or a disaster for that matter.
The needed response usually depends on the severity of the situation.
We cannot underestimate the importance of coming up with being prepared. And you talk about being prepared, you talk about having a plan for every emergencies or disaster.
The manner by which you should respond to an emergency is also vital in aiding someone in danger. Being conscious of the time frame to respond, for instance, should be a priority. The immediate response and preparedness may spell the difference in someone recovering quickly or yielding to permanent disability.
scene sides up, we have to ensure the safety of the responder. So that's yourself. Second is your partner. Third is your patient. And then fourth is the bystanders that is present in the area.
Whether you're at home, school, or workplace, you should always have a solid game plan if ever you find yourself or other people in danger. What should you always have in your first aid kit? What are the steps in performing CPR? How can you properly administer the Heimlich maneuver? Find out the answers tonight on MedTalk.
And joining us tonight is Mark Libo-on, the Academics and Operations Director and a Senior Instructor from Stout Risk Reduction Management Training and Consultancy Services. Also with us tonight is Pamela Cruz-Briones, a licensed physical therapist and a senior instructor also from Stout Risk Reduction Management Training and Consultancy Services. You may join our discussion by calling our hotline at 548-4678. Good evening, Pam. Good evening, Mark. Welcome to the show.
Good evening.
Emergency preparedness. In the VTR, it was already explained, but can we take it from a different angle this time? What do you mean by emergency preparedness? Mark.
Emergency preparedness answers the question of how ready are we emotionally, physically. It also means the government's effort in pre-positioning equipment, assets before any disaster would strike.
Mm-hmm. So in being emotionally and physically ready, are we ever emotionally and physically ready for an emergency? Pam? This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Responding to any disaster can be tough, whether it's man-made or a natural one.
Natural disasters, example of that are floodings, earthquakes, typhoons, tornadoes, and man-made, bomb explosions, fires, chemical spills.
The situation may call for an immediate response to a car crash, medical emergencies,
Actually, it's not always that we can prepare for such. But if you have certain training or knowledge on certain events or disaster, or you have a basic knowledge at least of first aid, so if that happens, it will really pop out from your mind. Mm-hmm. So what to do?
Parang stock knowledge,
yes.
No? So when you're faced with this an emergency situation,
yeah.
yung stock knowledge mo from training and hopefully from watching the show today, because we're going to teach them the basics of first aid. We're going to teach them all they need to know when faced with an emergency situation.
Yes.
So, and speaking of an emergency situation, what are the most common emergency situations, man-made or natural, that we Filipinos face?
Yeah, for man-made, we do have fires, chemical spills also, with stampede, and of course for natural disasters, we are very frequently visited here by storms, typhoon, earthquake, floodings, those stuff.
Those are quite common.
Those are the common ones. And recently there was an earthquake, and we suffered other natural calamities. No, with the behavior of Filipinos or people in general.